Now, as you well know, because I've probably said it 100 times, South Africa is in phase 2 of its vaccine rollout campaign, and it's received over 1 million jabs so far. But there are concerns the rollout is moving too slowly. Heidi Giokos is following this story for us as well. So Heidi, of course, we know week 2 kicking off this morning. Gauteng, how's it going here? There have been some issues.
There have definitely been some issues, but we've actually just received a communication from Gauteng Health to indicate that over 40,000 Pfizer doses were administered in week 1. And this is quite significant for the province. We do know that the province is leading with regards to healthcare workers that were vaccinated under Sisonke, but as well as those that have been vaccinated for week 1 of phase 2. But there have been some issues with regards to the electronic vaccination data system, with many people not knowing if they can actually go to vaccination sites, if they'll be accepted, if they are 60 and above, those senior citizens and the elderly who fall into the category of phase 2 for now. But we do know that according to the Gauteng Provincial spokesperson that they believe they're doing all they can. They've communicated as much as possible, and they are seeing an increase in those that actually want to register for the vaccine, those that are registering. And what's interesting here is that the province is saying that they cannot turn anybody away when they get to vaccination sites. Now, we have seen how many people get to the vaccination sites and they are told they cannot be there because they do not have a voucher and they need to only get to the vaccination sites on appointment basis. But according to the province, if you fall into the category, you cannot be turned away. You should be assisted, even if you don't have a voucher number, as long as you have registered. So in terms of how the province is faring, it seems as though this week they are going to increase, hopefully, just looking at Michael Morelia's video wall, hopefully we'll be seeing those over 70,000, not just in the province, but across the country in terms of those vaccines. But let's listen to the Gauteng Provincial spokesperson on where the province is faring.
We will not turn anybody away from the sites as long as they are registered, or there will be people at the vaccination sites who will be able to assist people with all that work of registration. The aim is to ensure that the people within the age category that is being vaccinated now do get vaccinated. So as government, we want to do everything to make it possible that those who are 60 years and older do get vaccinated. So we will publish the vaccination sites, but we'll also continue to call them, and we'll also encourage them to call the hotline so that they can establish when is their time to get vaccinated. A lot of people are saying they want to get vaccinated. We speak to them and they say we are just waiting for the SMS to indicate when and where can we be vaccinated. And our call to them is that do call, don't wait for the SMS only.
It's good to know that, hey, because I know so many people who are asking whether they can take their parents in because they haven't received any SMSs. But Angela Kutsia from the South African Medical Association was saying that it's not advisable to just go because then you risk of contracting COVID-19 in long lines. But those are two separate ways of looking.
Yeah, but just on that point, Sean, I think specifically for private facilities, private sites, the pharmacies and other private facilities that have been brought in, it's advisable not to just walk in there because they actually do work on the EVDS system and on a voucher basis. But in terms of the public facilities, the public clinics, the community centres and the hospitals, it seems as though they are more willing to take walk-ins because they cannot actually tell you to go back if you've already gotten to the vaccination sites and you're elderly and you need to get that vaccine.
You see, those questions, the answers, Lynn O'Connor, there's your answer. You were asking earlier, there's your answer. So let's talk about Denosa. They have concerns about the numbers not being released for phase 1B.
Yes, and we have actually been trying to get that information as of last week already to say we can see what's happening with phase 2. That is 60 plus that are getting the vaccines. But what about phase 1B? We know when Sisonke ended, government said that phase 1B and phase 1-2 will run concurrently together. Phase 1B is focusing on all healthcare workers and support staff that weren't vaccinated under Sisonke. We don't have those numbers yet, and it's clear from the communication sent out by provinces but also by the National Department every night when they send out those numbers numbers that there's no indication of what's happening with 1B. So if we vaccinated over 160 odd under phase 2, what does phase 1B look like? Because we have seen healthcare workers at vaccination sites getting vaccinated. Donos is saying it's completely unacceptable that government has not provided those numbers. If they are able to provide numbers for phase 2 and for the Sisonke and COVID numbers and deaths, surely they should be able to provide that for phase 1B. So let's listen to Donos on that.
Remember, these vaccines have been purchased using public funds. Also, the pandemic is affecting all of us nationally, so it's everybody's business. So it shouldn't be a private affair for the government. So they should be able to be open about the same way that they are open about the number of cases. We think that we should take that kind of approach whereby daily, daily updates even displayed on national television, so that everybody in the country can be able to see. I mean, every day when you watch the TV, you watch the news channels, you see that there's always a number of confirmed cases and so forth. We think that if they've got the capacity to update on the number of confirmed cases, surely there should be a capacity to confirm on the number of people that have been vaccinated, because it's a matter of tallying the stats at the end of the day, at the end of the shift, submitting them in a central point. So there's absolutely no excuse why they cannot release those numbers. But also, the vaccines themselves do tell us that if you received 50,000 vaccines and you report that you have finished all those vaccines, then you already know that if you have exhausted 50,000 vaccines, it translates to 50,000 people that have been vaccinated. So they should be open about that process.
So I know you mentioned the private sector coming in to help here as well. So they have come on board when it comes to the vaccination process. How are they contributing?
So we were actually at Mill Park early this afternoon just to gauge how the process is unfolding at Mill Park Hospital. But we were told that they've only started with phase 1B as of today. They haven't even started their process of phase 2. And the reason for this is because they solely rely on the electronic vaccination data system. So they get a list every day to say these are the appointments that are booked specifically at this hospital, and these are the people that you can expect. So we know that today they were expecting over 500 healthcare workers. Tomorrow it will most likely go up to 700, then they'll increase to about 1,000. But this is an interesting one because these private facilities actually have the capacity to vaccinate over 1,000, 2,000, but they depend on the government's data system to say these are the amounts of people coming in. And it's crucial for these private sectors to come in and offer a helping hand for government to vaccinate as many people as possible. They have the facilities. We know Diskim, for example, started off today with their vaccination program, again, only on a voucher appointment process, clicks as well, and we know that Discovery has also increased its sites to 3 now, 1 in Joburg and the other 2 might be in Cape Town. So it's going to be crucial to see how the private sector is going to ramp up the vaccination program. And also, Shahan, before I forget, we do know that Gauteng has increased its vaccination sites to 63. So this is going to be another key point to see how week 2 is going to roll out with increased vaccines and increased vaccination sites. Hopefully, we'll get vaccinated soon and go sit on a beach.
I think it's going to be better and better, right? Because I saw that AMPAT and Lancet and all of those people are in the drop menu when you go into the EVDS website as places you can go to get vaccinated. So it is going to get better. Let's be positive for once, I guess. Yeah.